Thank you, Mr. Chairman. Thank you for holding the hearing, and the panel, thanks very much for being here. To our small business people, everything that you've said are things that I've heard in Colorado over the last months as people have, even before this recession started, grappled with the question of how to cover people in what are often family businesses, people that have relationships with one another and desperately would like to provide insurance. And Mr. Rowan, one of the things that struck me in your answer to the chairman's question was that you said you really didn't know why the premium was going up by 128%. Is that right?
I think what I meant if I said that was that I didn't know, based on the current pool of people that we insure, based upon what their history was utilizing health insurance doctors over the previous year, and knowing to a limited degree what they might be facing in the next year, why that overall understanding interpreted to a 128% increase, or why it interpreted to a 70% increase in the health risk of our pool itself.
And were you able to get other bids on the policy that might have explained what the differential was?
Well, we were
suggested the reason why.
Over the last, say, 10 years, we've probably had 8 different healthcare carriers in the last 10 years. I think we've only had 2 years where we were able to carry the same carrier for the second year. So what has happened to us is that absolutely every year, virtually, we go out and try to rebid our health care. This year, we were able to. We ended up with a policy that essentially is costing us about 43% increase, rather than the 128% increase. I think part of it was that the health assurance, which is the policy that we had last year, knew what our group was. I don't know that our group went through the audit process. I think they just simply took our age group and everything and gave us a new policy.
I've had people in Colorado sort of refer to it as a game of musical chairs. It rolls around once a year when people have to rebid this. And my hope is that we're going to have a much more transparent marketplace for small businesses going forward than the one we had.
We did have underwriting, though, with our rebid, and the 43%, it was underwritten by the new insurance company.
And thank you. Mr. Holtz-Eakin, I wondered, you had a list of things that you said would be real reform that we should make sure we attend to. And on that list, you talked about reform of the delivery system. And I do believe that the most important thing we should be doing here is figuring out how to lower costs for everybody, no matter what, or at least reduce the rise in costs, no matter where you come down on various other choices here. That's what's strangling our working families and small businesses in the country and defeating coverage. And I wonder if you could just, on that subject alone, the delivery system, in your view, what is it that you'd like to see that's not in the legislation?
Well, I think I'd like to see...
And then I'm going to ask Dr. Gruber the same question.
I'd like to see that be the primary focus of the legislation, so that when these reforms are undertaken, the Congress looks to see if they work. If they do, we will see Medicare, Medicaid rise more slowly. Resources will be freed up in the federal and in the state budgets, quite frankly, and coverage expansions can follow along in a fiscally responsible fashion. So one is simply sequencing. Second is, what do you do? I would urge you to do things that are in bills, but do them more aggressively. One of the primary drivers of bad medicine and expensive care in America is the Medicare payment system, which has 4 siloed payments to make sure that hospitals get their money, docs get their money, insurance companies get their money, and drug companies get their money, and the beneficiaries nowhere in there. There's no coordination. There's no emphasis on paying for quality outcomes or making sure people are well to begin with. The federal government pays half of America's health care bills, and that system drives a lot of bad medicine. We pay doctors more to do more. We pay hospitals fixed amounts and say do less. Doctors practice in hospitals. It's utterly schizophrenic. Okay. So I would start there. I know you're running out of time.
No, I'm sorry, and I am. And I wanted Dr. Gruber, who I think made an interesting point, that one doesn't want to let the perfect be the enemy of the good here, but if, in your judgment, you are looking for improvements in the parts of the bills that deal with delivery system reform, what would you be looking for?
I mean, I think that what Doug's laid out is exactly right, and there's a lot of people out there who know that that's what we need to do. The problem is there's not a lot of people out there who are willing to put that in legislative language. And the issue is basically, if we wait for that to be in legislative language, we won't get reform. Basically, what we have now is a reform that will do what we can do today, and I think actually does a lot of things that starts us down the road towards those reforms. There are pilots of the kind of accountable care organizations Doug advocates, and I think are very smart. There's a Comparative Effectiveness Institute to study what works and what doesn't. There is sort of a MedPAC on steroids committee to try to take a look at our physician reimbursements. I agree with Doug. I'd like to go further. I just haven't seen those ideas in paper to go further, and I don't believe we should kill this bill, which CBO says is deficit improving over the next 20 years, because those ideas haven't yet been written down.
Thank you, Mr. Chairman.